The following may not be suitable for all audiences. Viewer discretion is advised.
The second piece of news I want to tell you about is some developments about another new strain of this virus. Of course, the fight against the virus is a global effort, and we're constantly vigilant and looking around the world. And as part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. The Chief Scientific Advisor and the Chief Medical Officer and others met their South African counterparts over the last day, and we are incredibly grateful to the South African government for the rigour of their science and the openness and the transparency with which they have rightly acted, as we did when we discovered a new variant here. This new variant is highly concerning because it is yet more transmissible, and it appears to have mutated further than the new variant that's been discovered in the UK. We've taken the following action. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight must quarantine immediately. By quarantine, I mean they must restrict all contact with any other person whatsoever. We'll be changing the law to give this legal effect imminently. Now, these measures are temporary while we investigate further this new strain, which is shortly to be analysed at Porton Down. And I want to thank everyone involved for the seriousness with which I know that they will take these new instructions.
One person in London and another in the northwest of England have caught the new coronavirus variant from South Africa. The unidentified people are the first known in the UK to be diagnosed with a rapidly spreading strain. They are thought to have been in contact with people who have travelled between South Africa and the UK in recent weeks. In response to the arrival of the more infectious new strain, the Health Secretary, Matt Hancock, has ordered anyone who has been in South Africa in the past 2 weeks to quarantine immediately. Anyone who has been in contact with those travellers must also quarantine and have no contact with anybody else. The new UK variant is already everywhere, and this is a picture of the areas which the Public Health of England has listed as having the new UK variant. The South African strain known as 501.V2 has been blamed for the surge of a second wave there, with upwards of 900 cases recorded per day. The country's health minister said the variant appears to cause more disease in young people. However, this has not been scientifically proven. It may be that young people are more likely to break the COVID restrictions and therefore are picking up the virus more frequently. At this point, the symptoms appear to be the same as the usual COVID: a loss of taste and smell, continuous cough, and high temperature. The disease can also cause fatigue, a headache, diarrhea, muscle pain, and delirium in older patients. It is not clear if it causes more severe disease and therefore deaths. The mutations in this virus means it's possible it can reinfect a person who has already recovered from COVID-19, according to Professor Peter Horby, who heads the government's new and emerging respiratory virus threats advisory group, NERVTAG. It may also make vaccines less effective because the immune system does not recognize the new variant when it infects the body. But both of these factors need to be investigated deeply before conclusions can be made. The same is the case for the UK strain, and Public Health England scientists will be studying this. However, it could take weeks for answers. Professor Horby told BBC Radio 4's Today program the South African variant is a concern because for two reasons. One, it's rapidly become dominant, so it would appear it may be more transmissible than the other earlier viruses, but also it's got quite a lot of mutations in what we call the receptor binding domain, which is the part of the virus which is critical for infection and antibody responses. Those two reasons are why this virus is a worry. It may be more infectious and so make control difficult. And these three mutations in the receptor binding domain may have an effect on the ability of antibodies to neutralize the virus. So that may mean it's easier to get reinfected, and it may mean antibody-based therapies and vaccines are less effective. We don't know that for sure until the lab experiments are done, but the structural data would suggest that's a possibility. He said that it was important to control the new strain because the UK one has proven that once it had spread, it is hard to control. The events that have unfolded in the past week, the discovery of two new variants of the killer coronavirus, have served as a warning of what is next to come in the pandemic, scientists have suggested. Mutations in viruses are a natural part of their evolution and are expected. As they change, they can gain mutations that give them a new advantage, a better ability to spread, cause death, or evade vaccines.